Welcome back to This is VANCOLOUR. Something that affects just about everyone in British Columbia is access to a family doctor. Even those of us who have a doctor sometimes feel like it's hard to get an appointment or that we don't get enough time with them when we do get that appointment. But what challenges do family doctors in BC face when trying to care for their patients? Here to discuss is the founder of Zili Care and a past president of BC Family Doctors. You can also find her in conversation with Dr. Gabor Mate at the Beyond Wellness event on April 21st at the Granville Island Stage in Vancouver. She is Dr. Maryam Zeineddin.
Thank you.
Dr. Z, nice to see you. Thanks for being here tonight.
Thank you. I just loved how you pronounced my name. I was like, wow.
I have practiced, actually.
Oh,
I'm not
really?
gonna lie to you.
I was like, oh.
Now, I feel like I always am focusing on my needs as a patient when it comes to primary care.
Yeah.
How long it takes me to get an appointment with my doctor, and then when I get that appointment, only getting 10 or 15 minutes.
Yeah.
But I want to kind of, turn the tables here and ask you, as a family doctor, what are the challenges that you face in delivering care to your patients?
Yeah. And, I've been a family doctor now for 20 years, even though I may look very young. But over the past 20 years, what I've noticed is, yes, we have so many other concerns from our own patients when it comes to access to us, when it comes to us being able to provide the care that they need in terms of the lack of resources, the lack of time that we have to even get them to specialists and get the imaging that we want. And also for the family practice, for the family physicians out there, the amount of administrative burdens that we are seeing now with the integration of technology and none of our systems actually speaking to one another.
So the technology is creating more administrative burden?
Some of it, yes, and some of it, no.
Okay.
Now we have AI Scribe that actually scribes our clinical notes, but we still have so many documents coming to us, so many labs coming to us from everywhere. And for us to even have access to the right information at times where patients are seeing somewhere else is very difficult. Mm-hmm. So those are elements that need to be acknowledged 100%.
Yeah.
But what I'm seeing now more and more, and even if I actually look back from when I started practicing till now, 20 years later, is that my every appointment has a mental health component to it.
Really?
Yeah.
Okay.
And patients may come with their physical symptoms, but in fact, the sad thing about the conventional world of medicine is that we divide our mental health from our physical health, from our emotional health. And in fact, it's all one system. If you remember anything I tell you today, is that.
It's all connected.
Is that, when you come in and my patient comes in and they say, I'm really tired and I have headaches, or, we can't just focus on the physical symptom itself. We have to ask them way more about, what's happening at home? What are your relationships? What's your financial situation? And these are called the social determinants of health. And sometimes, within the short frame of time that we're seeing patients, we can't address all the above. And we can't really delve into the preventative notion of what health is. In fact, a mentor of mine called the healthcare system sick care system. Because you only will come to me
when I'm feeling sick, when I have
you're
some
sick.
symptoms.
Yeah, when you have symptoms.
Yeah.
But in fact, our healthcare system really ideally would be great if we can really be proactive and preventative and really be able to make our patients understand that the way you live, the society that you're in, the circumstances you're in when it comes to your relationships, when it comes to the burdened of technology and social media that you're consuming every day, it's not necessarily serving you.
Right. Why do you think more patients are coming in with mental health issues to their family physicians? Is it just the stress of the world, whether it's the affordability crisis or things like technology, like social media, like you just said? Is it kind of all these things coming together where people are just more stressed now than they were 30 years ago, 20 years ago?
Yeah, we live very siloed. And unfortunately, health has become very sort of individualistic. Really, if you really think about it, anything that's marketed towards preventative care is like, how do you take care of yourself? Like as a person, go to the spa or get a massage or, like
spend some money on something nice.
Spend money on something or exercise. And really, you have to eat healthy. Fair.
Yeah.
All those things matter too. But there is a thing called collective health. And right now, as a society, we're not doing well as a society. In fact, you're right. There's a lot of global instability. There's a lot of financial pressures. There is, even our sovereignty is at stake. I mean, if you really look at all the above and you look at how we're doing as a society and as a system, it's going to impact our individual health and well-being. So when you say, well, I don't really care what everybody else is feeling. As long as I'm taking care of myself, well, that's not going to work.
Yeah.
Really, that's not going to work. In fact, when one person in a family is unwell, most likely it will affect every family member.
Wow.
So
that makes sense.
Thinking of health as a collective responsibility is much better. And it really takes down the pressure on the healthcare system.
Yeah. So really quickly, in about a minute or so, I know this is a big question.
Yes.
What do we do? And I really mean this on a local level, because I feel like when we talk about healthcare, we talk about increasing capacity in terms of more doctors, more nurses, more medical specialists. Yeah. But aside from that, what else can we do to help address some of these issues to make your life a little easier to deliver care?
I think one of the biggest things is exactly what we're going to talk about in our event and Beyond Wellness is really to talk about what are the things every single person within their own community can do. So now we've introduced social prescribing. We can prescribe nature. We can prescribe you getting connected to a connector if you are socially isolated so that they can take you to the art gallery. These are just mini elements. We need access to counselors. We need access to social workers. We need to work in a team. We can't just be like, you fix us. We also need to fix us. But it's not about fixing. It's about all of us really understanding the true essence of health and well-being. It's not just individualistic. It's collective. And it's not, prevention is not luxury. It's a necessity.
I'm hearing more collaboration, more cohesion between different elements of healthcare delivery.
Yeah, and unfortunately, we haven't been able to do that yet. And we're pushing for that. There are many of us that are pushing for really challenging the status quo of what we understand health to be. And we need all community members, not-for-profits, to really work together. Even if when you have a rec center, a community center, a place where you can gather in a park, that contributes to your health and well-being.
Absolutely.
And people just take that for granted.
And I know you're on the forefront of that here in BC. Dr. Z, thanks so much for your time tonight.
Thank you so much for having me.
Folks, she will be chatting with Dr. Gabor Mate at the Beyond Wellness event on April 21st at the Granville Island stage in Vancouver. Tickets are available now. That was Dr. Maryam Zeineddin. Now, after some business, dating in 2026 seems worse than ever before. Is it all Tinder's fault? A leading voice in modern relationships will share her insights up next.